All right, hi everybody, Dr. Joseph Cipriano here, and so today we have actually quite a special patient here. So one, as you guys can tell, he is the owner and founder of Niobe. He'll get more into that in just a second, but one thing that I really wanted to talk about, the main reason on why he's here, so he is actually a survivor of a plane crash. Yeah, crazy to say, but yes, he got into a plane crash and has been having a lot of tailbone, a lot of sacral type issues, has been a lot of the chief complaints. And I know, like you were telling me also, throughout that mid-back area, he'll feel basically a vertebra come out of alignment. And the only way that he can get it back in is like if you have to lay on a basketball.
Yeah, roll around on the ground or have somebody jump on my back or something.
So instead of jumping on his back, we're going to do a full chiropractic adjustment. Now, we've already gone through, we've done films, so I do know exactly what's going on there. Right. But yeah, why don't you tell everybody a little bit more about what you do?
Right. My name is Derek Tippins. I'm the owner of a universal referral app called Niobe. So basically it gives every business like Dr. C or a hair salon their own personal app for a referral service. We're going to be launching hopefully next month, which is going to be November of 2018. Yep. And with our test group, full launch will be hopefully after the first of the year. So.
Perfect. So what I'm going to be doing, I'm going to have all the links, everything in the biography, and not just that, you guys are probably going to see it already go across the screen right now. But yeah, we're going to have all his information listed. You guys will be able to check him out, check out his product, and yeah, I can't wait to see him go live next month. That'll be actually really cool. Yeah. So let's go ahead and get started here. Right. I'm going to have you lay face down for me. So now the first thing that I do with every patient is I scan the body and I'm checking for any imbalances here. So when I come on in, I'll go through the cervical spine, see if I feel any tension. I look for symmetry, so everything that I feel on the left side, I want to feel the same on the right side. I look for any head tilts, I look for any high shoulders, high hips, any of those muscle imbalances. I feel into the muscle, I palpate in, and I'm feeling for the actual tonicity. I'm feeling if I find any taut, tender fibers. Things like that are what I'm looking for. So we're going to start up here in the cervical spine, and tight in general. So I'm feeling tautness, but now you got to realize I'm feeling this bilaterally. So this is overall, he's kind of something he's been living with. Now through his traps and through the thoracic spine up through here, yes, everything is all very taut. So we're going to be doing a little bit of soft tissue work to help release some of these areas as well. And now when I go a little bit further down in, so at least a good thing is I'm feeling the symmetry from the right to the left, which are good things. Just everything is very tight. He's a very tense guy. So things that we're going to have to do, we're going to have to really release everything. We want to take the pressure off the nerves. We want, for his muscles to relax, his ligaments to relax. We want him to be able to heal and function. So now when we go back, so we went from the cervical spine through the thoracic spine, now we're getting into that lumbar spine. So getting into that lumbar spine, a little bit lower. Down here on his sacrum is going to be his chief complaint here. So now once we took these x-rays, as we saw, there was a huge hip height differential. So what I'm going to do, we're going to take a look all the way down here, and let's take a look at his leg length. So when I push his feet in, you can definitely see how much shorter that right foot is than the left foot. I mean, it's a significant difference here. So it was that same thing. Yeah, you can really see that hip height. So what we're going to do now, also, I have already felt this and I already know what's going to happen. But for the viewers at home, what I'm going to do is I'm going to stabilize on the sacrum, and I want you to raise this leg up as high as you can for me. Any pain, tenderness, tightness with that?
Yeah.
Okay, a little bit of pain, tenderness, tightness. Now raise this side up as high as you can. Is that side a little bit easier?
Yeah.
Okay. So even in the x-rays that we took, One thing that we did already notice was his sacrum is pointed towards this left side. So what that's telling me is this side is going to be able to raise up higher, which obviously it just did raise up higher. So what we need to do, we're going to do a drop technique. It's a torquing technique, and what we need to do is we got to take that sacrum from here and we got to torque it over to the right. So we're going to do a drop with a counterclockwise rotation here. So table's going to come up from below, and we're going to do this drop with that counterclockwise rotation. What I want you to do with your ankles, I want you to take your bad foot, put it over your good foot for me, just like that. One more of those. Uncross. Good. I'm going to have you bend this knee. Good, just like that. And one more. And there we go. Good. All right, so I'm going to come back around. I want to do the exact same thing. So right here, I'm going to stabilize on the sacrum, and I want you to raise this right leg up as high as you can for me. Do you notice a difference?
Yes.
Okay. What do you notice?
I can raise it easier.
Okay, so he can raise this leg a lot easier. So now, one of the main things that was going on is he wasn't able to raise this leg up as high. So what was happening, like I said, that sacrum was rotated towards that left side, and what we just did is we started rotating that back to the right. Just from that adjustment, what I want to check is coming down to the leg length. Take a look at that leg length now. Almost completely balanced. So as you can tell, his main issue was right here. That torquing technique was a huge adjustment for him, and he's going to get a ton of relief with that. So this was just the start. What I want to do now is I want to work through the cervical, the thoracic, and a little bit in the lumbar spine, and really get everything just opened up and loosened up here. Okay. So we're going to start at that T1 junction here. Good. A little tight. Still very tight through here. Good. I felt a little bit of movement right when we first started distracting him there. So now we're going to do a P2A, a posterior to anterior thoracic adjustment. Take a deep breath in and exhale all the way out. Good. One more time, deep breath in. Exhale all the way out. Good. We'll do one more, a little bit lower. Deep breath in and all the way out. Perfect. So we got good movement on those first two there. Okay. So now, getting a little bit better movement in here. What I want to do, I'm going to do some soft tissue work just to help relax this area here. Okay. So just keep laying there as you are. So we're going to use what's called the vibrocursor. We just want to relax. We want to release some tension in the tissues in this area. So as you guys can tell, I'm following the basis of the traps here, going off to the right, to the left. We want to relax these areas, especially before we use the Y-strap technique. So after we use the vibrocursor, we're going to use the arthrostem just a little bit in that upper thoracic spine, just because it's been a very tight area to deal with. Okay, so with an arthrostem, what this is doing, the harder that I push in, physically push in, the harder it's going to push out and kick out on him. So we went moderately strong on that upper thoracic area, just because he wasn't getting the best of movement the first time around. Okay, so what I'm going to have you do, I'm going to have you sit up for me. I'm going to have you face the back wall. Good. Okay. So, what I'm going to do now, let me make sure and clear out the rest of this thoracic spine here. Okay, so I'm going to have you take a deep breath in. I'm going to bring you down, exhale out. Okay. Alrighty, so you can relax your arms. Okay. Perfect. So now what I want to do, we're going to use the Y strap. So I know you've seen videos of me using this before.
Right.
Y strap, what it's going to be doing, it's going to wrap around the base of the occiput. I stand at the top of the table and I'm going to distract in that Y-axis direction.
Okay.
Just because that I know that you came from a little bit of ways. You're a pretty built guy, in good shape. I'm going to do a little bit more force.
Okay.
So let's go ahead and get started. Now I want you to make sure and tell everybody at home how you would describe this to somebody. Okay. So I have his knees bent off the table. We're going to distract.
Oh, wow. Wow. Oh, man.
And relax right there.
Whew, that felt good. All the way down.
All the way down?
Oh, that's good.
If you were to tell anybody at home what you just felt, how would you
Man.
describe that?
I feel taller.
How tall were you when you came in?
About 5'5", now 5'10".
Yeah, about 5'10" now.
Yeah, definitely. I mean, wow, that really.
You feel how that opened everything
right
up?
there in the tight area that you were talking, they just really got it. Man.
Yeah, it just opens everything
It
up.
did.
What that does is it pulls the pressure off the nerves that exit between the spines. So when it takes pressure off of those nerves, what that's doing, it's allowing the body to function and to heal. So the less pressure that's put on those nerves, the better that those nerves are actually able to fire and able to work. So when we take that pressure off those nerves, obviously in your case, some people, they may experience pain, a tingling, a numbness, whatever.
Yeah.
What that does when you remove the pressure, it's just bringing your body back
In
alignment to an equilibrium. So yeah, it's a very powerful move.
Yeah.
And as you said, you felt that all the way from here, going all the way down?
Felt about the middle of my belly.
Okay. Yeah, come on up. Perfect. Yeah, so how's that feeling?
Feels good.
Feeling good?
Yeah.
Good. Yeah, so yeah, that's one of the most powerful moves out there. I mean, it really just takes a lot of pressure off the spine, off those nerves. So yeah, such an amazing technique here. Alrighty. Perfect. So if anyone is looking to schedule an appointment, feel free to go to my website. I have everything listed right on there. Yeah, I would love to have you come on in. And like I said earlier, we're going to put all the information up if you want to kind of get a nice little video of that. So what we're going to do, we're going to put all the information up, all the Facebook information, Instagram, whatever we got. We'll have it listed in the description. You guys are probably also seeing it run across the screen right now. But perfect. So how are you feeling?
Good. It was worth the 5-hour drive.
It was worth the 5-hour drive. That's what I like to hear.
Thank you.
You're welcome.
Everybody.
Have a good one, everybody.